Yes, the loop. Can't leave the nephron fun zone without hitting up the loop. I could tell you were moderately underwhelmed by the Procart track back there. What? Acetazolamide isn't even used as a diuretic? What? Mannitol exacerbates heart failure? What's the point? All right. It's time for the main attraction. This, my friend, is the world-famous Loop-de-Loop of Henley. It's the fastest, most loop-de-loopiest ride west of the Mississippi. The agents we're about to cover all work on the ascending limb of the Loop of Henley specifically. So later we'll sketch in some riders ascending the loop. For now, I want to emphasize how potent the loop diuretics are. By impeding sodium absorption along the ascending limb, the entire concentration gradient of the kidney is thrown out of whack. These agents are exceptionally good at promoting volume excretion. Heart failure, you say? This'll suck the water right out of there. Once you hit the apex of that loop, you better tighten your sphincters and hold on to your fluids, my friend, because you are in for a furious ride. Hey, look, there's one of those convenient park maps. Notice that we've worked our way a little more distally and are now waiting in line at what seems to be an exact replica of the Loop of Henley. Specifically, the sign indicates the thick ascending limb. Here, sodium chloride is actively resorbed, about 25% of the filtered sodium. Therefore, the solute most relevant to diuretic action here is that sodium chloride. So keep your eyes peeled for our recurring salty sodium peanuts. Oh, this line is taking forever and I'm starving. Where are those banana vending machines when you need one, huh? Oh, there's one. Save my spot. Remember that the potassium banana vending machine powered by the 3P batteries is our recurring sketchy symbol for sodium potassium ATPase. This is depicted by the concerned, health-conscious mom taking the salty sodium peanuts away from her son, exchanging them instead for a healthy potassium-filled banana. Just like at the Procart track, this ion exchange is occurring at the basolateral membrane. In other words, the yellow roller coaster track represents the lumen of the renal tubule. The gray platform represents the intracellular compartment, and the area in the background behind the wall represents the interstitium. The wall then is the basolateral membrane where the sodium-potassium ATPase pumps all the sodium you're absorbing out into the interstitium. This maintains a low intracellular sodium concentration to make room for more absorption from the renal tubule. You know, I like the mom's enthusiasm, but come on, lady. Everyone knows there is no food allowed on the Loop of Henley. This ride is way too fast. So the kid inside the car hands his salty sodium peanuts back to the attendant on the platform. Remember that the roller coaster track is colored yellow to remind you that this area represents the tubular lumen. So that means our loop employee is standing at the luminal membrane, distributing sodium back inside the cell. Check out that sign though. It's not only sodium that must be returned to the platform. No peanuts, no bananas, no chloride packets either. This transfer of ionic foodstuffs then represents the sodium-potassium 2-chloride co-transporter in the luminal membrane of the thick ascending limb. Notice that the sodium-potassium 2-chloride transporter itself is electrically neutral, with 2 cations and 2 anions co-transported. Oh, no, you don't need to toss that water. It's allowed on the ride, see? In fact, each car comes with a convenient, impermeable storage area to secure your water bottle. Unlike the proximal tubule and the thin descending Loop of Henley, the ascending limb is nearly impermeable to water. So as salt is resorbed, water stays behind and dilutes the tubular fluid. This is why this portion of the nephron is called the diluting segment. Since only solutes are absorbed here, not water, the thick ascending limb makes the interstitium of the kidney all salty. In fact, the thick ascending limb of the Loop of Henley is crucial for maintaining hypertonicity within the kidney, thereby setting up a concentration gradient that facilitates the resorption of water in other segments, especially the terminal collecting duct. So if you mess with this channel, good luck trying to pull water out of the tubule down the line. What's taking so long? Wait, what's all that commotion up there? Hey, that furious kid won't give up his food. Read the sign, buddy. Let this furious kid remind you of the diuretic furosemide. Furosemide selectively blocks the sodium-potassium 2 chloride cotransporter on the luminal membrane of the thick ascending limb. The agents that work on this channel are called loop diuretics. Pay special attention to those salty sodium peanuts that the kid clutches onto. Keeping them on the yellow track of the roller coaster means keeping sodium in the lumen of the tubule. This represents furosemide's ability to reduce resorption of sodium chloride and causes natriuresis. Remember, like I said before, where there is sodium, there will surely be water following it out. In fact, because of the large sodium chloride absorptive capacity of the thick ascending loop of Henle, crucial for setting up a water-conserving concentration gradient throughout the medulla, in combination with the fact that the diuretic action of these drugs is not limited by the development of acidosis like we saw with the carbonic anhydrase inhibitors back at the Procart track, loop diuretics are the most efficacious diuretics currently available. Oh no. Looks like the temper tantrum by Mr. Furious over here was so efficacious that the track workers have just given up. Come on, don't they receive special training for situations like these? Damn you, employee code of ethics. Let the word ethics remind you that ethacrynic acid is another loop diuretic that acts on the sodium-potassium 2 chloride channel. Although the sodium-potassium 2 chloride cotransporter itself is electrically neutral, the action of the transporter contributes to excess potassium accumulation within the cell. Well, potassium diffuses back into the tubule through a special ROM-K channel, causing the lumen to gain a positive electrical potential. This pushes other cations, including magnesium and calcium, out of the tubule and into the interstitium. By blocking the sodium-potassium 2 chloride cotransporter, therefore, loop diuretics also reduce the lumen positive potential that was driving magnesium and calcium resorption. So they stay behind and get excreted as well. Delicious calcium ice cream and M-shaped magnesium magnets are our recurring symbols for calcium and magnesium, respectively. Notice how the furious kid's comparably aggressive brother is clinging onto his calcium ice cream and his cherished lanyard of charming and collectible magnets. I mean, can you blame him? Oh, yikes. Looks like those magnesium magnets are turning into lethal ninja stars. And that calcium ice cream is turning into a face milkshake, excreted right out of those kids' chubby little fingers. As you might expect, prolonged use of loop diuretics can cause significant hypomagnesemia in some patients and occurs most frequently in patients with dietary magnesium insufficiency. Let these falling magnets represent the potential side effect of hypomagnesemia. Hypomag can be reversed by administration of oral magnesium. Hypocalcemia is possible as well, but it's rare. You see, since vitamin D-induced intestinal absorption and parathyroid hormone-induced renal reabsorption of calcium can be increased, loop diuretics do not generally cause hypocalcemia. Nevertheless, we included this falling calcium ice cream to remind you of this rare side effect. What the? Hey, that guy's cutting. Whoa, is that a baseball bat? Ooh, the Pro Slugger model. Good choice. You win. So I'm not sure if you're familiar with the Pro Slugger bat yet, but it's our recurring symbol for prostaglandins. Loop diuretics have been shown to induce the expression of the cyclooxygenase enzyme COX-2, which synthesizes prostaglandins from arachidonic acid. These prostaglandins actually inhibit salt transport in the thick ascending limb of the loop of Henle, enhancing the action of the loop diuretics. Let's just say with that prostaglandin Pro Slugger, this kid does as he pleases. The prostaglandins produced by COX-2 also increase renal blood flow in the afferent arteriole of the glomerulus. Likewise, this furious kid is using that Pro Slugger to beat his way through the crowd and open up the afferent line to the coaster. Increased afferent blood flow means increased solute delivery to the nephron means enhanced diuretic action. Okay, that's not fair. We've been waiting here for what, like 6 hours? Oh, good. Looks like the track attendees have caught on and are putting that problem child in its place. Code of ethics be damned. NSAIDs, such as indomethacin, inhibit cyclooxygenase and decrease the synthesis of prostaglandins in the kidney. NSAIDs can therefore interfere with the actions of loop diuretics, as shown by this extinguisher, to subdue this furious furosemide pro-slugger. All right, you know what I like to do to pass the time while waiting in line? People watch. You'd be surprised how accurately some people reenact the clinical indications for loop diuretics. Take this guy, for instance. Aw, it's the poor ashamed father of that furious kid, holding an even sadder looking floppy heart balloon. The most important clinical indication for loop diuretics is for the reduction of peripheral or pulmonary edema that has accumulated as a result of heart failure. Well, this floppy heart balloon is our recurring sketchy symbol for that sad failing heart. When cardiac output is reduced in heart failure, the decreased blood flow to the kidney is sensed as hypovolemia. Think back to the renin-angiotensin-aldosterone pathway we illustrated at the casino. You can imagine that if the kidney isn't seeing the blood flow, it'll open up that renin umbrella and activate the chain of events leading to increased aldosterone, increased salt and fluid retention, and eventually increased intravascular volume. This fluid retention may initially restore cardiac output, but as the cardiac deteriorates further, the kidney continues to retain salt and water, which begins to leak from the vasculature and cause interstitial and pulmonary edema. This is where loop diuretics come in to save the day, as their diuretic action reduces the accumulation of edema, particularly in the lungs. Loop diuretics are the first-line treatment in acute decompensated heart failure with fluid overload, since they are the most potent diuretics. They cause the maximum amount of diuresis in the shortest amount of time. This will be emphasized by the number 1 on the heart balloon. Notice, too, the sopping wet lung-shaped life jacket worn by this failure of a father. It emphasizes the important role of loop diuretics in the management of pulmonary edema that results from an acute exacerbation of heart failure. On the exam, it might go a little like this. A 62-year-old man presents to the ER with severe shortness of breath and orthopnea. In other words, when he lies down, he can't breathe. He has a medical history full of conditions that increase the risk of heart failure, including hypertension and myocardial infarction. On physical exam, you'll find elevated JVD, crackles on lung auscultation, and pitting edema in the extremities. This guy is fluid overloaded. This man needs a loop diuretic. Remove fluid from his lungs and now he can breathe. The improved oxygenation will improve cardiac function. Remove all that fluid in his veins, and now we're talking preload reduction. The heart doesn't overfill and can pump more efficiently. However, I want to emphasize that loop diuretics do not prolong life in heart failure. They only reduce symptoms. Prolonging the life of the heart usually requires counteracting that insidious cardiac remodeling. But don't lose hope. We'll run into some diuretics that actually prolong life in heart failure soon enough. Let's shift our attention to the mom, who's looking pretty silly with that big yellow inner tube stuck around her midsection. That jaundiced, dilated abdomen kinda reminds you of ascites, no? Liver disease can also be associated with edema, particularly ascites due to elevated portal hydrostatic pressure and reduced plasma oncotic pressures. As I mentioned in heart failure, these systemic vascular alterations can lead to reduced blood flow to the kidney, setting off a chain of events that leads to increased salt retention and exacerbated edema. Loop diuretics can be useful in cases when this peripheral edema and ascites become severe. Man, we're so close to the front of the line. Almost there. I can feel the steam seeping out of those high-pressure industrial-sized pipes that power this roller coaster. Remember that loop diuretics may also be useful in non-edematous states, such as in the treatment of hypertension. While they are not the diuretic of choice for this purpose, they can be especially useful for treating hypertension in patients with comorbid conditions such as heart failure with edema. Diuretics lower blood pressure by depleting body sodium stores, which reduces blood volume and cardiac output. More powerful diuretics like the loop diuretics are especially useful in treating severe hypertension, renal insufficiency, and in cardiac failure or cirrhosis when there's marked sodium retention. Just like we saw with the cetazolamide and the banana peel attack at the procart tract, loop diuretics are potassium-wasting diuretics. When they inhibit salt resorption in the thick ascending limb, the sodium stays in the tubule and ends up at the collecting duct. When sodium's reabsorbed at the duct, it's traded for potassium, leading to increased potassium excretion and hypokalemia. So as the coaster races up that ascending limb, a potassium-depleted banana peel is thrown from the track. From one of those furious furosemide kids, no doubt. This hypokalemia can be especially harmful in that heart failure patient you're trying to treat, because hypokalemia can exacerbate any underlying cardiac arrhythmias. So keep an eye on that potassium level. Ooh, you hear that gong? It means that yet another rider has survived the loop of Henle. Let that ear-piercing sound remind you that loop diuretics occasionally cause dose-related hearing loss, which is usually reversible after stopping treatment. Plus, the loop kind of looks like a cochlea. You know what I mean? I can't take it anymore. Boo! Let's throw things to demonstrate our impatience. Yeah, rotten eggs. Boo! I don't know about you, but stinky sulfurous eggs remind me of how most loop diuretics, including furosemide, are sulfa drugs. Therefore, a sulfa allergy, including skin rash and eosinophilia, can occasionally be seen. Ethacrynic acid, on the other hand, is not a sulfa drug and can be used in patients who develop symptoms of a sulfa allergy during treatment with a loop diuretic. Interstitial nephritis is another possible side effect of sulfa drugs, such as furosemide. Let this kidney-shaped ticket container filled with little blue tickets remind you of the infiltrating white blood cells in the kidney interstitium, which show up as little blue cells on histology. You know what? I sympathize with this girl over here. She's so bored from the wait that she's whipped out the needles, knitting away her boredom. Those big pointy needles should remind you of the needle-shaped uric acid crystals that can precipitate in the kidney or in the joints during a gout attack. Hyperuricemia is a relatively common finding in patients treated with a loop diuretic and may, over a period of time, lead to gouty arthritis. Excessive use of loop diuretics can cause hyperuricemia because uric acid reabsorption in the proximal tubule is enhanced during states of hypovolemia. Speaking of hypovolemia, recall that sodium absorption at the loop of Henle is critical for setting up the osmotic gradient that facilitates water reabsorption in the collecting duct. Loop diuretics prevent this salt reabsorption, break down that concentration gradient in the kidney interstitium, and therefore prevent water absorption at the terminal collecting duct. This can lead to potent volume loss and severe dehydration. So, as our last loop attendant cleans up the mess left behind by the careless and disrespectful park attendees, that squeezed bottle depicts squeezing out all that fluid, leading to dehydration. But as he squeezes the bottle of cleaner, think of contraction. Contraction alkalosis, that is. Loop diuretics can cause metabolic alkalosis by many mechanisms. For instance, the hypovolemia induced by loop diuretics causes renin production by the kidney. Increased renin means more aldosterone, which causes potassium and hydrogen excretion. Also, increased renin means increased angiotensin II. Recall from the Ace Casino sketch that angiotensin II works directly on sodium reabsorption at the proximal convoluted tubule. This is a sodium-hydrogen exchanger, so you're kicking out more sodium here as well. Whenever we want to convey contraction alkalosis, we'll bring back this bottle of alkaline bleach being squeezed, or contracted, if you will. All right, since we have time to kill, let's sum up this sketch. The loop-de-loop of Henle encompasses all the events at the loop of Henle, of course. But remember, we're talking about the thick ascending limb here, emphasized by the cars ascending the loop. Water is not absorbed here. Instead, it's secured safely in the car and stays in the tubule. Sodium, potassium, and chloride are normally reabsorbed at the thick ascending limb. However, the furious furosemide kid highlights how loop diuretics keep those ions in the tubule to be excreted. This action also leads to calcium and magnesium excretion. Remember, the falling banana peel. This is a potassium wasting diuretic. Loop diuretics are your go-to agents for dropping volume. They're the first line for symptomatic treatment of heart failure and can also help treat the edema associated with liver or kidney failure. The volume loss caused by loop diuretics leads to a metabolic alkalosis, termed contraction alkalosis, by multiple mechanisms. And watch out for that last loop. That ringing gong is ototoxic. All right, if you haven't noticed by now, I've really just been trying to stall while we waited out in line. But I give up. I'm hot. I'm sweaty. I think I have a mild coup contra coup injury from that baseball bat over there. Let's go get refreshed at the distal convoluted tubule, shall we?